Welcome to the Mindset Podcast TV Live, and today we have Jose. He said just Mendoza. Everybody, before I get started, go to YouTube and like and share, please, and subscribe. Platinum Mindset TV Podcast. How you doing today, Joseph? Jose.
Thank you for having me here.
Thanks for coming on. So tell everybody a little bit about you.
Well, I'm in an interesting sort of field because I am in the medical field. I started off working in cardiovascular invasive procedures. So what that is think heart attacks, think pacemakers, think strokes, things along that line. That's where I started, but at the same time, I'm also doing a style of Chinese medicine that helps to bring people back their time, back their energy, and back their focus. And that's essentially what I
Oh, I got some questions for you because I've been going. I'm going to have a cardio CTA on Wednesday. I thought I was having lung problems again because I've had 50 blood clots in my lungs. Just been
yeah.
like, I'm talking like, I feel like life has been pulled out of me. Like I'm cooking dinner and I can't cook. Like I can't do it. I'm like to the point where I start doing something and it's just like, oh, I can't go anymore. So I went to the hospital and they said that they want to do that test or whatever. I just don't know it's a horrible feeling. It's worse than any of that lung stuff I went through because it's like I can't even push through it.
Yeah. Yeah, with that, that's quite a problem because now you're working with the respiration aspect, yeah. So you can't get enough oxygen, and it starts to bring up like bouts and feelings of anxiety, yeah. And that's exactly where a lot of people spend their life too, is in anxiety. Like you have the issue coming up, but there's other stressors too that get piled on top of that. And now you're having to deal with two different fronts coming at you.
Yeah. I think it could be like a blockage or something. I mean, could that cause me to be tired and no energy?
Well, you said you had history of lung clots, yes?
Yeah, I've got. And what's crazy is I haven't been on blood thinner in almost 2 years because I got off of it. But they said all my tests were perfect, but I need to get back on blood thinner. I'm like, my tests were horrible when I was on blood thinner. Hell no.
Yeah, so like they're gonna go and they're gonna check. They're gonna make sure you don't have any blockages that are preventing you from really getting oxygen. Now, it could also affect your respiration if it's a heart-related issue. Because if the heart's not receiving the oxygen it needs, then it's going to affect the rest of the body too. And it's one of those things because in Eastern medicine, the heart is at the center of so many things. So then if your heart is affected, of course, it's going to reverberate through the rest of your life, yeah? And like in your particular case, you're saying that your symptoms are like fatigue, like you get winded and tired very easily. Is that correct?
Hmm. Tired, freaking headache real bad, and achy.
Achy where?
My whole body. It's like pains that I could push through normally are like 100 times worse.
More joints or more muscles?
I guess my torn shoulders are a lot worse now, but it's just achy feeling. It's just worn out.
So when we look at like the Eastern perspective, and this will relate to what I'm talking about too, with the heart and the lungs and everything, is we focus on flow. Flow is the number one thing. We want to have smooth, continuous flow. Think of a river, just like a river. A river flows, it feeds the aquatic life, it feeds the plants that are around, it sustains everything. When that flow is interrupted and it's reduced by, say, a beaver dam, as an example, now everything downstream gets affected. Now you're not able to continue and carry on as you need to. The land gets dry, the plant life starts to wither. Whatever aquatic life was there is also going to suffer as a result of less water flow. And so in your case, this is exactly what is going on, is that there's some sort of obstruction within yourself that's causing this and is making everything else worse because your joints were bothering you before, but would you say that it's been worse than before?
Um, yeah, way worse, way worse.
Yeah, and that's an example. because now that whatever this obstruction is within you is now causing everything else to also be in a state of panic, you could say. Everything else is now worse off because of.
Mm-hmm.
But let's shift it a little bit, because even in the Western world, when we're looking at the heart, even if blockage is present within an artery, if there is some sort of obstruction, the body has a way to sort of compensate and make up for it. And this is true even from the Eastern medicine side, is that there's always compensatory mechanisms that make up for it. So in other words, you could push through something, you could do it for so long. But what happens if that compensatory mechanism gets taken? So in the heart, for example, certain vessels will dilate in different areas to help offset that reduction in flow. But then if you go and you do exercise all of a sudden, let's say, now everything gets dilated and there is an issue. Because now the compensation that you had is now affected by everything else wanting its fair share.
Like my blood. Let me tell you what my blood pressure was. I had to like keep a record of it. It got pretty high. One point it was at 242 over 139 with 126 heartbeat. But I don't feel it. I feel no. I felt perfectly fine.
Yeah. And like I said, part of that's that compensatory mechanisms, yes? It's like you've had it, you're used to it. But this also relates to like different aspects in life. If you're, for example, working in a job and the stress of the job is something that you're not fond of, then at a certain point you kind of just push through it and it becomes the new normal for you.
Mm-hmm.
So to give you like a little bit of an example, one of the hospitals where I used to work, it was busy and we were constantly working, and there were long nights and early mornings. And for a period of, I think it was a few years where I was working there, as soon as I finished, I noticed, oh, this is what it feels like to get proper sleep. Because I wasn't getting proper sleep, I wasn't feeling refreshed. I didn't realize how offset I was until I was shown what it's like to be set back. So, in this focus that I have with the Eastern medicine, the example that I give is, imagine that your life at any given moment, it doesn't matter what it is that's affecting you. It could be mindset, it could be stress, it could be the fact that you don't like your job, whatever the case is. It's as if you're standing on one foot with your back towards the ocean on a cliff and you're trying not to fall off.
Mm-hmm.
That's your only focus in that moment. But what would happen if you were assisted back, planted firmly on both feet, and now you're able to take in what's going on and what had happened and how you got there? Now you're no longer in this state of panic that you were teeter-tottering this whole time and that was normal for you in that moment.
Mm-hmm.
Now you're back, you're grounded, you're rooted, you're able to actually focus and think about, what is it that I need to do now? We're past this. I no longer need to suffer like this. And that's an important thing, because who wants to be in chronic pain? Who wants to be suffering all the time? This is the work that I do, is where we get people back into a state of balance, back with both feet on the ground, back where you can actually see everything around you instead of having a narrow focus.
Mm-hmm.
Because far too often, like, we can be blinded to these small things. And of course, as a coach, I'm sure you've seen other people will be blind to certain things, and it takes an additional person, a guide, a facilitator, a coach, whatever the case is, to point this out and say, hey, have you seen this? Did you notice this about yourself?
Yeah.
So that's a very important aspect of this work. And that's why I always say that it's a you and me type thing. So let's assume for a moment that you and I are working together. There'll be things that I can do for you, and there'll be things that you need to do for yourself.
Mm-hmm.
Because too often we give too much to everyone else. We're constantly giving out, giving out. What's going to happen? If you're constantly donating, let's say, your money away, to the point that you're using credit cards to donate your money away, what's going to happen to you?
Broke as a
There's
joke.
nothing for you to survive off. Yeah, right? So it's a
Yep.
big thing. you have to take that moment for say and say to yourself that, you know what, this is important. I need to take time for myself. I need to correct this so that I can go forth and do whatever it is that I need to do for anyone else.
Hmm. See, my thing is too. Is like I don't. My sleep is horrible. If I can't sleep, I get up. I go. I do something else. But it's like even if sometimes even if I don't want to take anything, but if I have to, I'll take like I have the trazodone they gave me a long time ago, but I try not to take it because if I do, it either doesn't work because I have adrenaline disorder too. So it either doesn't work or it works way too hard. I don't want to be dependent on medicine because I don't take anything for pain. I don't take anything for that. I want to get out. I don't want to take any medicine.
Yeah, yeah, and everybody's landscape is different. Yeah, because even for the people that are taking medicine, as an example, doesn't matter the medicine. Some medications you have to go and see your physician every so often to get readjusted
Hmm.
because taking the same dose all the time doesn't always work. Day to day and month to month, year to year, if you look at yourself, there's always a constant shift and change. There's always
Hmm.
something different. It's never the exact same thing because although we are known poetically as like flesh machines, we're not robotic. And so you can't consistently do the same thing over and over and expect to still get the same results. Things shift and change.
Yep.
And that's also part of the nature of the Eastern medicine stuff that I do is that there's change and transformation, there's shifting. Where you are now is not where you necessarily need to be or want to be.
Hmm.
So then how do we get you from where you are to where you want or need to be? And there is the process. There is where the magic lies, so to speak. So it never comes down to, oh, once this is done, it's set in stone. No, there always has to be a constant observation. You got to look at it
Hmm.
and say, okay, what did I notice different about this? And it's an important thing. And I don't think some people realize that, especially with medications, every so often they need to get readjusted. And you have to check with your primary physician on that.
Yeah. I mean, I think that's like anything in life too, because it's like working out the same way. If you do the same thing, exercise over and over and over and over, your body's gonna stop growing. It's never gonna change. You're expecting to get bigger muscles, but you're doing the same bench press on Mondays, bench press on Mondays. Like you gotta change it up. Stop doing all these. You gotta keep changing it. Everything, change everything for your mindset, your fitness. I mean, just like eating healthy, you can't eat the same thing over and over and over and over. You're gonna get tired of it, burned out.
Yeah, yeah. Pressing 135 is only going to get you so far. There's only so much you can do with 135 before you gotta up the ante and do something different.
Shoot, I'm doing 10-pound dumbbells.
There you go. Yeah, I mean, it's what you got to do, right? That's the important thing is you know where you're at. And it's a crucially important thing, especially when it comes to anything that's mindset related, fitness related, nutrition related, whatever the case is. You need to know where you are and you need to be okay with where you are in that moment. You know,
Hmm.
if you can list off all the things, okay, this is all the things I got, great. Now you have a map laid out. You know where you are on the map. Find where you want to be, and now you can determine the route. Now, with that, you can get to where you want to be, but you have to know where you are first. That's the key important thing. And you have to be okay with that. If you're one of the people that's really struggling financially, you have to know that's where you are. That's okay. This is the beginning. I don't have to stay here.
Hmm.
What's the next thing? Where do I want to go? So figure out where you want to be. If that means you don't want to be drowning in debt, okay, then you need to figure out it's time to clear the debt. Okay, how do you clear the debt? That's where the routing comes in. That's the next step.
Now, do you think when it like sometimes? Okay, so I feel sometimes if you make a route, there another route could come up that you could take that might be faster and easier, but you already wrote that mind, so your mind is gonna say, "Nope, I'm gonna stick to this route." Sometimes making a route sometimes might make you takes longer. What do you feel about that?
Sometimes that faster route's a trick. I mean, think about it. Even when it comes to weightlifting, if you're trying to build more mass, there is a way to do it faster. It's called
Hmm.
steroids. That's a shortcut, but is it better for you in the long run? Does it fit with your goals? You might get to the same destination, but are you going to be the same? So think of it like you're taking the routing, but then you change the car. Yeah, you went to a faster car. Let's say you went from a Honda Civic to a Jaguar, let's say, like a really fast Jaguar. But is the Jaguar going to break down after you get to your destination? How much is that
Probably
going to
so.
cost to repair once it breaks down? You know, like that those are the things you have to consider. Just because it's a
Yeah.
faster route doesn't mean it's better. And even in my line of work, it takes as long as it takes. And this is true for anything, whether you're talking about the Western aspect or whether you're talking about the Eastern. When I'm talking about the Western aspect, if we're going in to fix somebody's heart attack, it takes as long as it takes. For some people, it's quicker. For some, it's not as quick because
Mhm.
everybody internally is different. And the same thing when it comes to the Eastern medicine. If you come in and you have all these different issues, and we focus on one issue, we're going to stick to that one until we finish that. Even though you might think that this one is popping up and maybe it's related and it might be faster and easier, it's like, no, this is the issue we're working on. This is the one we're going to stick to. This is the fastest way. Because we have a saying that says, the long way is the quickest way.
Explain that one to me.
So when we say the long way is the quickest way, because you're focusing on the one thing, you're focusing on that path. You're not deviating from it. There's distractions all the time. This might be a quicker way, this might be a quicker way. But if you're sitting there and you're doing that route, you're steadily putting in the miles to get to your destination, you will get there instead of stopping every 5 minutes to go look at this thing over here or trying to take this alternative route and then you get lost and then you have to double back and get back on the same route.
Hmm.
There's no shortcuts. That's why it's the long route is the easy route because if you try to find a shortcut, you're just going to end up sabotaging your progress in whatever it is. There's
Yeah.
no shortcut. There's the single route that you pick, and that's it. You follow, you stay with it until you get to your destination. That's what saves you time. Hence the saying, the long route is the quickest route.
What is your opinion on peptides? It's a big thing now.
Peptides are a big thing. I don't know enough about peptides in terms of their long-term effects to really fully say what, like, where they fit in with things.
Hmm.
I knew for the longest time SARMs were a big thing. People were really into SARMs, but then as more information started to come out, it still seemed like they replicated the effects of steroids in the rest of the body a little too much.
Yeah.
And so I'm a little concerned that with peptides, it's possible we may see the same thing. Maybe it's dose dependent or not. I don't know. But when it comes to peptides, I don't think there's enough long-term information to really know the
Mhm.
effects just yet. They're still so relatively new, in my opinion.
I know there's one is like this thing does. It helps your muscles heal faster. It builds muscles. It helps hair growth. It helps skin. It helps your inside organs. This thing is like the magic peptide. It's
Yeah,
crazy.
yeah. Like one case example, I think was BPC 157.
That's it. Yep.
That one's supposed, yeah, that's the one that's supposed to help you heal joints and do everything else. And yeah, it can. There's like an oral version. There's an injectable version, which apparently the injectable version is painful, 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 painful
I've
to
taken
put
it.
to be injecting. But is the short-term benefits really worth the risk? I don't know because we don't know the long-term effects. And that's the biggest thing. Maybe a couple doses is okay and negligible. It's like smoking. This is kind of the way I see it as like smoking. If you smoke constantly, we know the long-term effects because it's been studied for a long time. So if you smoke every day, you're smoking 2, 3 packs a day, whatever the case is, this is the area where you could fall in all these different risk factors, heart disease, stroke, lung disease, and everything else that comes with it. But what about the people that smoke a cigar once every 6 months?
Hmm.
How's their risk compared to that? It's different. So because I think we don't have enough data, it's really hard to say. But at the end of the day, I still kind of hold to that opinion that there's no shortcuts. You just have to power through it.
Now I did. I got a shot in each one, like one little IU of that peptide. Man, it felt my shoulders felt amazing. The pain was like non-existent.
And has that pain come back since?
Yeah, but I mean I've worked the hell out of my shoulders too lately.
Right. But the way I kind of equate it is like this. When people take a cortisone shot that's supposed to help the joints, whenever you have inflammation or pain or anything, it does. But what some studies have found is all it does is it blocks the nerve receptors.
Hmm.
It doesn't do anything to the joint necessarily. So there's a possibility of down the line, you get a degeneration of the joint over time. Now, that being said, you're blocking the pain, but still working through the joint. So the issue hasn't been resolved. although you feel better. Because when pain shows up in the body, pain is an indicator, number one indicator to say, this is wrong. You need to look at this. So then the question would be, what is the next area to look at? What is causing that? So for some people, they have a rotated
I got
shoulder.
two torn rotator cuffs. I already
Yeah,
had surgery
yeah,
and tore it again.
yeah, yeah. And those are big things to work through, yeah. But like some people will have a rotated shoulder. It's like, okay, is it a shortened pec? Is it a shortened bicep tendon? Like, would stretching be enough to help you do that? Do you push too much and not pull enough?
Hmm.
Yeah, so you have to look at all the surrounding aspects too to really be able to gauge what's the issue. And that's where the Eastern medicine part comes in. It's like, what's the core issue? What is it that caused it? Because when you get to the Western world, if we're talking about cardiovascular disease, you're already there, you're already diseased, we fix it. When we talk about the Eastern aspect, it's we're looking to prevent it. So, what is the environment that's causing this to show up? And how can we reduce that so that everything settles back into a state of balance and to a normalcy, basically?
Well, it's almost like the Western is all about diagnosing you around some kind of pharmaceutical. 100%. It's like, let's see, you have high blood pressure runs in your family. Let's put you on a pill. No, high blood pressure don't run in the family. Get out of here. Keep your pill. It's like, no, dude. It's crazy because I can sit down still right here and my blood pressure is through the roof. I go work out. It's perfect. Perfect.
Yeah. Yeah. But that's the thing is the point that you made is taking charge of your health instead of outsourcing it to someone else. That doesn't mean you can't ask for expert advice. That's important. You got to ask for expert advice, but it's you taking the initiative. It comes down to your accountability to
Mhm.
say, I don't want to be ill. I don't want to be in pain. I don't want to be hurting or anything else. I want to be out of this. What is it that I need to do so?
Yeah.
So you have to take responsibility for yourself to then be able to get out of that, right? If you dug the hole, you have to crawl out of the hole.
Yeah.
You can ask for help, but you have to want to get out of the hole in the first place. You
That's a
can't
big
just sit
word.
there for someone to pull you out. Yeah.
Want. I think today everybody wants that instant gratification. That's the biggest thing.
Yeah. Yeah. It's hard. It's hard with the way things are portrayed. It's mostly with the way things are portrayed, in my opinion, because everything is just a quick hit, a quick hit, a quick hit. I mean, you look
Hmm.
at TikTok. Yeah. TikTok, I think, used to be, they didn't allow videos over a certain length before, if I remember correctly. I
Hmm.
think 30 seconds, maybe 30 seconds, maybe 12 seconds. I forget. They had a short one. But even before that, there was a video app. It was called Vine. I don't know if you ever came across Vine.
Hmm.
Vine only allowed 6 seconds. So whatever you had to fit in, you had to pack into 6 seconds and put out there. It failed because people couldn't monetize it. But then several years later, TikTok came about. They had a slightly longer record time, but still, that shortened span just hits you. And it's no
Yeah.
different when you're on Instagram. You're on Instagram, you look at a photo, and then you decide within the first few seconds if you like it or not, move on to the next, move on to the next, move on to the next. Each one is a different hit to the brain. And so that way it's working with the circuitry is what gives us that instant gratification effect. Because now it's like, well, I don't need this. I can move on to the next thing. I can move on to the next thing. And we don't sit there and we don't work on the long term benefits
Hmm.
anymore. I mean, back in the day, you had to go and plant your wheat. You had to wait for it to grow. You had to tend to it. Then you had to chaff it, winnow it, grind it down, and then you could have bread. But it wasn't until you did the whole process that you could have bread.
Hmm.
And now you're getting that hit. Now you're getting that response. Now you're getting that feel good.
Yeah.
But now because we have access to all these different applications, social media and everything else, you can get feel good in 3 seconds.
Yeah.
And if you don't like it, you just go to the next one. You go to the next one, and now you become addicted.
What's crazy, I think, what was it, like last year, 2023, something like that, it said from the time, like 100 years ago, whatever, till that point, it took that long to get the information. Now that much information takes 3 seconds. It's crazy. That's what I was
Yeah,
asking somebody today. Why are kids going to go to school anymore? Because all they're going to use is AI to do everything.
yeah. You could just go to YouTube University and get everything you need. Yeah,
Yeah, exactly. But it's like I used to have to, I remember, and I'm only 42, I had to go get encyclopedias, go look it up, research this, get on internet. There was no internet. And if I did, it was like, loading. Now they don't have to spend the time to research anything. It's University of Google. And it's like they're using zero brain, zero effort. They're becoming. You ever seen that movie Idiocracy? That's what this world. That's what it seems like it's coming to soon. People just gonna be dumb.
Yeah, and a lot of it is because we outsource things. We
Hmm.
outsource too much so that we have less on ourselves. But it comes back to that accountability thing. Ultimately, there's only so much you can do. Let's imagine that you could outsource everything. You could outsource every single thing in the world, but you're most likely not going to be able to outsource your breathing. You still got to breathe for yourself. Most likely, you're not going to be able to outsource eating. You can't have someone else eat for you. They can feed you, but you still have to eat. Yeah. There's only so much that you can outsource, but how much more do you want to outsource? Because essentially, what you're doing is you're giving away your own power at that point
Hmm.
to someone else. Now, how are you going to be firm, stable, secure, and safe if it's dependent on a different system on someone else? And that's where the issue comes down to. If you're depending on something else, what happens if that something else disappears? Then what are you going to do? It's like a hamburger shop. If a hamburger shop is dependent on having bread, they need to have bread. What happens if all of a sudden all the bread manufacturing stops? There's only so
Yes.
many lettuce wrapped burgers they're going to be able to sell. Yeah.
Yeah.
Their whole livelihood falls apart because they're depending on a different system.
Hmm.
As opposed to a mom and pop shop, let's say, if they were able to grow their own ingredients in house, then they're not dependent on anybody else.
Hmm.
So even if they were impacted in some small way, they still have their own power. They still retained it to be able to continue to serve in the way that they were serving. So that's a big thing is how much do you want to outsource? How much power do you want to give out? Some
Yeah.
things are inevitable, but how much do you want to give out?
True. So are you do you push more medicine or non-medicine?
Right now I'm 50-50 because I'm doing both. So I'm still working in a Western world, but I'm still implementing the Eastern principles separately on the side. So I do half and half.
Hmm. Yeah. See, like I was when they died, like 2018, they diagnosed me with that whole blood clotting thing, factor five, protein S, and some other thing. And they put me on the first they put me on Coumadin, then they put me on Eliquis, then they put me on something else, and I was throwing pulmonary embolisms left and right on the medicine. Then they put me on 2 shots of Lovenox a day, which is miserable, and I was still throwing clots. I'm like, this is pointless. Why am I taking this? Oh, you're at high risk. You get off. I said, I'm at high risk on this stuff. I'm clotting on it. I have a 0%. I have a zero blood clot factor right now on Lovenox, and I'm clotting. I'm not taking this stuff. And since I got off, no blood clots. All my blood tests are like perfect. All my levels are perfect. And then they say, "Up, you need to get back on blood thinner." I don't think so, buddy. You're getting too much kickback. It's just crazy.
Yeah. Yeah. No, but it's interesting. Yeah. And like that was your experience with it is that despite you receiving all the treatment that you were getting, it's like it was still happening. So then
Hmm.
what is really causing it? Because once you find what's really causing it, then you can stop it. And fortunately for you, it's like you stopped taking all the stuff and it stopped happening.
Plus, I
Right?
don't, I don't, I don't have any more blood clotting factors except one, I think. I don't have the other ones. How does that disappear?
Yeah.
Plus, I have
Yeah.
sarcoid, which is called. I don't even. I fully don't even know sarcoid that much. I read about it. I have pulmonary, neurological, and optical. So I have all three. But I know when I have the optical going on because it is miserable. But other than that, I mean, it's hard to. Everybody's like, "What is that?" I'm like, "It's hard to explain what it is." I mean, because there's really not much research because it's got to be active to research it. You don't know when it's going to be active.
Right. Yeah, yeah. No, I mean, and that's the thing. Everybody's unique landscape. So the way we do things in Western medicine is you typically get a one-time diagnosis. Yeah. Whatever it is that you have. If you have an ulcer, it's an ulcer.
Hmm.
Everybody, doesn't matter who comes in, they get diagnosed with the same set of symptoms, so to speak. This are actually signs, not symptoms. Signs are what the physician observes. So if they get the same sort of signs, then they're diagnosed with ulcer. When you look at Eastern medicine, say the patients come in, say that they have the signs of ulcer and they're diagnosed as ulcer, each one's going to have a different landscape that caused the ulcer in the first place. One person might be because they're too hot internally, is how we would describe it in Eastern medicine. They're too hot internally. Another one might be because they're eating too much spicy food and they need to stop on the spicy food. And so each person is looked at individually and tended to. If you imagine each person is like a garden, not every garden is going to be growing the exact same plants in the exact same place. You got to be looking at the individual gardens to tend to them as needed. Maybe the
Hmm.
drought plants that are, or the drought tolerant plants are over here. So then you're going to water this side, not that side. But the next person, they're in the center. So then you're going to water both sides. And that's the difference between the two there.
What do you think this new executive order on 80% less on prescriptions is going to do to the medical world?
I think it's a bit too soon to say because realistically, the prescription medicines aren't public, they're private. They come from private companies. And a lot of the physicians may may work in private or public hospitals. So you have
Hmm.
physicians that do private practice and they do the ones that do public. So each one has its own benefits. I think the ones that are managed more by public hospitals will probably be more impacted. So more of the government hospitals, maybe the VA hospitals, but when it comes to the private practice, and because a lot of the prescription medications are private, they're owned by private companies, I don't think it'll be as big as an impact as we think it will be. Because when a new medication comes out, typically whoever created that medication has a patent on it for so many years
Hmm.
before a generic is able to be made. So let's say the patent is 10 years. So for 10 years, they're the only ones that can make it. This is the price, and that's all there is to it. But then after so many years, now generics can come out. So that company will still sell it, and they'll probably still sell it at the same price. But now anybody can come in, formulate it, and create their own. They just have to name it differently.
Yeah,
So I don't think it'll be as big as an impact as we'll see because of the majority of just private sector that there is.
I think it's just going to be because of a money thing. Because now they're not making all these hundreds of billions of dollars off prescriptions, so it's going to be like a lot. Hopefully, some of these pharmacies just go, "Woo!" And they just get out of it because this country is run on pharmaceuticals. I mean, just look at that doctor that just went to jail for what 500 patients he diagnosed with cancer that didn't even have cancer
Hmm.
because they're getting kickbacks from freaking chemo. That's sick. I don't see how a doctor can sit like when the doctor told me to get back on medicine. How can he look at me with a straight face and say your blood results are perfect, but get back on medicine? But again,
Yeah,
if they don't sell the medicine, they don't make no money.
yeah. It's a sad fact. So when it comes to, for example, in the field that I'm in the Western side, those guys that are in the office seeing patients, prescribing, doing all of that, they'll make more money than a physician that's actually doing a surgically or minimally invasive procedure. So the
Mm,
cost of the procedure, the portion that the doctor gets, is less than the office visit. So then the people that are actually doing the procedures because they care, they're earning less than the
mm,
ones that are in office. And it's not to say that the ones that are in office care less, but it's just you could already see like there's a bit of a disparity that could cause people to lean more towards one way than the other.
yeah,
And really the only factor, in my opinion at least, the only factor would be the level of integrity that the physician
it's a
has
big
or the
word in
level
the
of care that he has.
medical field.
Yeah,
But
yeah,
it's
yeah.
like
Oh,
it's crazy because we were just talking about this yesterday. That if I don't say you don't have insurance, well, the bill is going to be 30 grand. If you have insurance, insurance gets to negotiate to like $3,000. It's just it should be opposite. It's crazy.
yeah, yeah. But there's also something else with insurance that's interesting because the way insurance works in the hospital is that everything's a fixed price, so to speak.
Mhm.
The insurance will pay this much for whatever it is that you purchase. So assume that let's say it's a pill. Let's say it's just a pill. If the hospital gives you the pill, your bill might say it's $300
Yeah,
for that one pill. Okay? But they have to state that because insurance ain't going to pay them $300.
no,
Insurance is going to negotiate and pay them less for it. So usually, if you do pay out of pocket when you go to hospitals or anything, even though it seems expensive at first, it's actually less because now the hospital doesn't have to fight and negotiate with an insurance company. They can charge you closer to what they would actually charge.
Mhm.
This isn't true of every hospital, but for most hospitals, it will be cheaper to pay out of pocket.
Yeah, I mean, I actually used to run a hospital, and she's like, yeah, they got to charge this much in order to get what they want, what they need to get. Because if they don't, if they charge what they need to get, they're never gonna get it. But it's
Yeah,
like nowadays
and
you
that's
got.
that's
Oh,
what
go ahead. Go ahead.
I was just going to say. That's what it comes down to for the hospital to survive. They have to charge more to actually get what they need, and sometimes it's just to break even for some of these hospitals, and that's really unfortunate.
Do y'all have Ochsner by you?
Which one?
Ochsner Hospital.
No.
So Ochsner's pretty big around here. It's I think it's pretty big in the South and all, but it's a non-profit organization, right? That the CEO gets like 40 million a year in salary. That to me is crazy. It's like I could be non-profit too if I make 100 million a year. I got a little bit more. Let's go buy a Lamborghini for a company car. It's crazy some of
Yeah.
these nonprofits. But like getting back to
Yeah.
insurance, like insurance, let's say now a lot of these insurance are making you go to your general practitioner before they even then you got to get a referral to go here to go there. It's like how is that saving them money, the insurance? Because now you got to pay the GP, then I got to pay the next doctor. Like they didn't want to give me an MRI for my shoulder, they wanted me to go to therapy. Okay, so you're gonna send me to therapy, spend money. You're gonna send me to the GP, spend money. Why not just send me straight to the orthopedic? I can get the MRI and done. Because eventually that's where I'm gonna be anyway.
Yeah, it's part of it is the way insurance works, at least to my understanding. If you're paying a monthly fee, so then they'll say, go do this, go do this, go do this, go do this. Oh, you can only schedule during these times because it's for them to accumulate enough funds from you or from other people to be able to pay that. Whereas if you go and you pay out of pocket, you can get seen quicker and it's cheaper, even though it's a lot more upfront. Because if you tally it up, for some people, you can go through and you can tally it up. How many months did I wait before I got this? How much was I paying monthly for that? How much would it cost me if I paid out of pocket? Typically, what you'll see is it's cheaper and quicker if you pay out of pocket for it because the insurance has to accumulate money from you or from other people. Because if you have, let's say it's 500 million people, just some crazy number, on one insurance plan, and they're all paying the same amount of money. If half of those people are sick, then it's not just those people that are paying that get covered for them, it's the other
Mhm.
people that are paying too that help to cover those fees.
Like when I was on that Lovenox, if I mean insurance paid for it, but if I wouldn't have been, I had like I think it was like 8 boxes a month. That stuff was like $1,900 a box. Who the heck can afford that? That's
Yeah.
crazy.
Yeah, a lot of yeah, unfortunately, a lot of the stuff is prohibitively expensive. Yeah, the more technologically involved it is, the more expensive it'll run.
That stuff was miserable. That stuff burned so the needle didn't hurt. Because I mean I had to do it twice a day in my stomach, so you only get so many spots to shoot it. It burns so freaking bad. Whew. Stuff is horrible. So what else can you tell us about what you're doing and all that?
Well, as I was mentioning, it's all about bringing people back into a state of balance, yeah? And a lot of this is just easy stuff. Now, what do I mean by easy stuff? It's like a lot of it you work on your foundational stuff, right? Because who's accountable for you? Who's responsible for your own health? It's you.
Hmm.
So if you're sleeping right as best you can, if you're eating right as best you can, if you're drinking enough water, if you're doing all that, that's going to help a lot in the long run, your exercise, everything else. Then that gives you a platform that you can then look at where you are and be able to shift yourself. So it's like you're doing all these things and your sleep's still not right. Okay, now you can start looking. Well, I'm eating okay, I'm hydrating okay, I'm exercising. So what's missing? What's the next thing? And now when you can find those little things that grab your attention, you can start to work on those things and fix them. So okay, maybe I need to have a more consistent bedtime routine. Maybe drinking alcohol like an hour before bed isn't the greatest thing. Maybe I exercise too late. Whatever the case is, you can start tweaking things to be able to get yourself back into that calm, balanced state. Because at the end of the day, the body's always seeking balance. There's a term called homeostasis. The body's always looking to seek balance. There's
Hmm.
times where you're high, there's times where you're low, like hormone levels rise and drop. So the body's always seeking to have a balance. So you do everything you can on your end to keep yourself in that state. And sometimes that requires outside assistance. Because if you're looking at all these things, you're like, I can't. Remember, we're blind to some of our own things.
Mm-hmm.
If you're there and you're like, I can't see this. Okay, I need help, and you go get someone to help you, then they'll say, here's the problem. Oh, now I see it. It's like one time if I went to go see personal trainer. So I was very dedicated with my work and I felt pretty good about it, but I knew that something needed tightening up. I said, okay, maybe they'll find like three, four things to really tighten up my form in this one thing. And as we were doing the 1 hour session, it ended up being something like 14 different things, 14 different points that needed tightening. And so I thought to myself, wow, like I knew that there were blind spots. Everybody has blind spots, and it
Mm-hmm.
doesn't matter how much material you read and how much you do something. There's always going to be some areas you don't focus on that someone else has to bring your attention to.
Yeah.
But now imagine, like in my case, you get these 14 points to work on. It's like, wow, this is some work to do. But by the time you're done with that, you're in a much better position than you were. Everything
Mm-hmm.
feels rock solid. And so this is no different. It's like you do the best that you can and you work to get yourself comfortable into a state of balance. And then when you need outside expert advice, you go for outside expert advice to really fortify, dial in, and improve everything else. And that's what I bring to the table. Because when we stop focusing on what's not helping you and start focusing on the things that you want, on
Mm-hmm.
the things that bring you happiness, then you'll start to get more fulfillment. Then you'll start to get more time back. Then you'll start to get more energy instead of feeling scattered and pulled in four directions or more, depending on how much you have to deal with on a daily basis. And that really is what the essence of this work that I do is.
What's what would you advise? Because like if, let's say energy, low energy. What's something that let's say men for low energy. I mean, I don't want to go take hydroxy cut and take energy drinks. I'm not gonna do all that. So like something that helps energy other than just like eating good and
Yeah. So the first thing, of course, is make sure the foundations are down. Make sure you're eating well, make sure you're hydrating, make sure you're sleeping, make sure you're exercising. Because one of the biggest things when it comes to energy is how's your mitochondrial count doing?
Mhm.
And you're like, wait, what? Mitochondria, which are the powerhouse. That's the powerhouse that brings about the energy in the body, that fuels the workout, that fuels your motion, that fuels your mind. Like, how is that doing? Because if you're exercising improperly and you're not developing enough mitochondria, you'll feel a little tired. If you're not eating well and you're overweight too much, you're also not going to feel well.
Mhm.
So one of the biggest things you could do is focus on developing more mitochondria. Now, how do you do that? So proper exercise. In other words, don't run yourself into the ground. Okay. As often as possible, as fresh as possible, and as strong as possible. So, in other words, if you're lifting heavy, not to the point of fatigue, and you're doing it as often as possible, that's going to help to build strength. It's going to help to also build mitochondria within you.
Mhm.
And there's other things you could do. For example, men benefit a lot from ice baths or cold showers. There's a huge benefit, and it also kickstarts and upticks mitochondria. But also, from a dietary perspective, you want to avoid things like seed oils. Because the problem with seed oils is the rancidity of it affects the mitochondria to the point that they could actually split or fracture and they don't work properly.
Mhm.
For other men, it's the fact that they eat too many carbohydrates. Because what carbohydrates will do is they'll pull and hold on and retain water. So if anybody's ever gone keto for a day, you'll notice that your weight drops dramatically. And that's from the excess carbohydrates pumping out the excess glycogen dropping down,
Mhm.
and the water goes with it. So it'll bind and hold water, but too much will also make you tired. If you have too many carbs in one sitting, your actual testosterone levels plummet. And for those that are interested, the number is over 75 grams of carbs in one sitting. Now, and then that also brings up the water. If you're not having enough water to actually hydrate, lubricate, and move you, you're also going to feel fatigue because water is necessary for the blood to flow. Water is necessary for the
Mhm.
lymphatic system to also clear out whatever the cells are pushing out. So if you're not circulating enough water, then your brain's also not getting enough hydration for it to function properly. So there's all these different factors that play a role with it. So it's like movement, food, water, all of that really is important, but it's how you do these things that matter too. Not to exhaustion. A couple cold showers here and there will help. You don't have to do ice. Do a regular shower, and then when you're done, turn off the hot water. Just leave the cold water and just spin in place if you have to a couple times for a minute. It's
Hmm.
tough, but you will feel so much better after that. All of these things will help to develop a little more mitochondria and getting sun. That's a big one too. If you're out there getting sun, you're 20 minutes and not showering right after. That's a big point. Don't shower, don't put on sunblock for a few minutes because if you shower, it's actually going to reduce the vitamin D that's necessary because it gets formed on the skin. So it'll reduce some of that, and then you're not able to utilize it within the body.
Hmm.
Okay, those are all key things, and all of those help to aggregated together help to bring about a change in more energy. And especially if you're exercising, the biggest thing is focus on making yourself leaner. The leaner you are, the more energy you'll have because it actually helps to balance out the hormones. Too much
Hmm.
fat means too much estrogen.
Yeah.
If you lower that down, that's how you can get testosterone to go higher.
Well, you know how they had like these little snacks and it's got like peanuts and stuff. Peanuts are horrible for testosterone, isn't it? It.
Too many peanuts. Too many
Yeah.
peanuts are bad because you're looking at the omega-6. Okay? When you want to talk about testosterone and fats, the best fats for testosterone are saturated fats. Butter, lard, tallow, even coconut oil. All those are better for testosterone because the saturated fat will help to one produce because you need the cholesterol. It'll help to produce the hormones. And the second thing that it'll do is it also helps to loosen up some of the testosterone to allow it to freely flow because some of it gets bound up. Testosterone
Mhm.
gets bound up, and there's other things that you can take that'll help to unbind it. But saturated fat will help to release more of it into the bloodstream. When you start doing these seed oils or these omega 6s and nines, things that get rancid really quickly, that's what will affect the mitochondria. That's what will also affect your testosterone level because some of those will throw you into a state of more inflamed, and more inflamed means less thriving, more surviving. So now you're just trying to kick stuff out and get
Mhm.
yourself back into a state where you can actually thrive instead of just trying to survive. So in other words, it'll throw you onto that cliff, like I said earlier. It'll have you teetering on the cliff as opposed to being planted on the ground.
I'm glad you said that about the butter thing. I love butter. I've been trying. I've been
Yeah.
cutting back.
And I mean,
Last week I had no butter. That's what's crazy. That's probably why I felt like crap.
but that's the thing. It's also sourcing. Yeah, you got to get decent source for your stuff. So like, if you're gonna get butter, you got to get grass-fed butter. Every time I hear grass-fed butter, I'm like, how do they feed the butter grass? Butter got no teeth. But the case is, you want to get grass-fed butter because the ratios are better. It's less of the omega 6, more of the omega 3s. It's balanced, but you
So
need to
not
have the
great value
saturated.
butter from Walmart.
Yeah. So a clue is the stronger the yellow color of the butter, the better it is for you. The
Hmm.
whiter the butter, you may want to stay away from it. You want to get that nice yellow one. I mean, for most people, actually, for most men out there, let's say price is an issue for most guys. That's fine. Buy whatever food you need to. Just spend money on high quality fats, high quality butter, for example. Or if you can get it, high quality tallow. Spend your money on that because
Hmm.
that's going to do more for you in the long run.
I tell you one thing, that butter from the store brand now, I don't think it's butter because it's like like even when if it's frozen, it's rubbery,
Yeah,
and then when I melt it, it's not butter.
yeah,
So it's like
yeah.
hmm.
And so that's the thing. Look for a nice deep golden yellow. That's the butter you want.
What is that stuff? The Amish butter or whatever it is? And that what comes in that
Yeah.
golden package? What is that?
You might be thinking of the Kerrygold. Do you think of the Kerrygold?
Maybe so. Some of one of those is Amish or something. One of them, or some kind of butter.
Yeah. Amish one would be fine too.
I know the government took all the Amish stuff. They're trying to catch back up on that.
Yeah.
That's
But
one
that's the
healthy.
thing.
That's a healthy people
Right. No, they're very healthy. Absolutely. Those people are very healthy.
because they don't
Strong
take
people.
medicine.
Yeah. Well, they live closer to the way we should be living.
Yep.
Yeah. They don't have electricity. They eat what they grow and whatever's local to them. They don't go and gather stuff from like they're not eating pineapple from Hawaii, for example. They're eating stuff that's local to them, that's in
Hmm.
season. They get up with the sun, they go to sleep with the sun. I mean, what more could you want? You're living with the cycles of nature. And that's a big thing in Eastern medicine is to live with the cycles of nature. What are the cycles and what are the rhythms? Like that's how you should be living. So if you're sitting on the couch eating Twizzlers, I'm gonna ask you, where's the Twizzler bush? Because I've never seen one. I'd like to find one.
You'd be rich.
Yeah,
It's like a blue zone almost. They're Amish.
yeah, absolutely.
I would love to live in
And
a blue zone,
mhm,
like
yeah,
Greece.
yeah, exactly. Because it's beneficial. You get all the good aspects, all the good aspects. You get better food, better community. There's better life all around.
Hmm. Yeah, I guess it's like honey. Whenever you get honey, you should get local honey.
Yeah, local honey is so much better than getting honey from what is it, like the Manuka honey that comes from wherever it
Indonesia.
comes from. I can't remember. Yeah, yeah, yeah. It's better to get local stuff. Anytime you can get your hands on it, get local stuff. If there's farmers markets in your areas, go to the farmers markets. Get local stuff. It's
Boy, I went to the
much better
farmers
for you in
market
the
last
long run.
weekend. This farmer was crazy with his prices. I'm like, I thought it was supposed to be cheaper.
In a sense, yeah, you think it's supposed to be cheaper, but the real question is not why is farmers market so expensive? The real question is why is store food so cheap?
Mass
And
production.
part of the reason is like overseas labor, because some of the stuff comes from overseas. But part of the reason is they have so much stored up, Lord knows where or how, that they
Hmm.
have to get rid of it. And to think about it, if you buy an orange from a farmer's market versus an orange from the supermarket, both the same kind of orange, it's a navel orange. Guaranteed, farmer's market is going to taste a lot better for you
Oh yeah.
than the one from the store bought. And there's a reason for that. It's beyond just freshness. But it's like if it tastes much better, why not go with that? That's why I was saying it's like if you can't, at least focus on spending your money on getting good quality fats.
Hmm.
Like everything else, if you need to get it cheaper, go get it cheaper. That's fine. You are where you are and you need to do what you need to do. But if you have the money to get local, get local. And if not, worst case scenario, just focus on high quality fats. You're going to be paying just a couple more dollars to get
Hmm.
better butter.
Yeah,
So unless those couple dollars mean life or death for you,
it's like those what's those things called? Those little orange, the little oranges. They peel easy and they got no seeds.
mandarins, yeah,
How the heck are they producing more of them? They got no seeds. I
yeah,
mean, it's got tiny, tiny
yeah.
seeds. You can't see them, but it's just crazy how genetically engineered that is.
Well, when it comes to things like that, all they're doing is they're not engineering it so much as they're just basically cloning it.
Yeah.
All they're doing is just basically chopping off a branch, plugging it into the ground, and it grows into a tree. And that's how you
Mhm.
keep it the same. That's one of the reasons why the original banana went out.
Yeah.
There was a banana. If you ever had Have you ever had banana candy?
Yeah. The fake ass banana candy tasting.
Yeah, so it has that like really unique taste to it, yeah?
Hmm.
That's what the original bananas tasted like, the ones that we used to have everywhere in the stores. And they had seeds, but the problem is because they were grafting them like that, they were cloning them. Eventually, there was a disease that came by that basically wiped them all out. And now we're left with these bananas, which were less favored back in the day.
Hmm.
But that's all we have because these were the ones that were resistant.
It's just like because I do horticulture, so it's like so the same thing with like roses these days. Roses have been grafted and grafted and grafted so much, a rose has no smell. Or they have like hibiscus. So whenever hibiscus flower, they'll create like a friend of mine. He has a big, huge place where he creates all these different colors. Well, after they keep growing the same one over and over and over and over and over, it becomes white. Basically, the color is extinct because they basically run the color out of the plant.
Yeah, because think about it. If you're cloning something, you're not creating something brand new.
Hmm.
If you're chopping off a branch from a 5-year-old tree and you plant it in the ground, it's not a 1-year-old sapling. That's a 5-year-old tree. So then when it
Hmm.
grows up and it starts producing fruit, let's say 5 years later, it's a 10-year-old tree. And if you keep doing that, you're just adding on to it. So over time, at a certain point, you're gonna be cutting off a branch, starting a new tree, and it's like 1,000-year-old tree.
Yeah,
How strong do you think that's gonna be?
not strong. That's why, like, somebody told me the other day, like, actually about 2 years ago, I had a garden center, and they're like, I have a 200-year-old rose bush. I'm like, what? She's like, yes, it was my great great grandmother's. I'm like, I bet you that thing smells good. And she's like, it smells amazing. Yeah, because it's been what you said, cloned so many times. Roses have no smells, none.
Yeah, yeah, and that's the thing of it. So why do the same thing? Why not find a different way to do things? And that's also how the Eastern medicine plays in. Is not about doing the same things. It's like, no, there is a different way. You just have to find it and then actually do it. Actually
Hmm.
follow through and do it.
Yeah, I would love to be able to grow all my every because I mean I'm in an apartment for the first time and it sucks because I'm used to going out and grow because actually I have some pepper plants and some vegetables at a friend of mine's house because I couldn't bring them here and I'm like, man, it sucks not being able to grow your own stuff, not be able to do stuff outside. But for now, gotta work. So how
Yeah,
can everybody get in
exactly.
touch
Yeah.
with you?
So I have a website, rise2human.com, and on Instagram I am JMDCEM. So that's Jose Mendoza, Doctor Chinese Energetic Medicine. Both ways you can contact me. One will be through consultation, the other one will be through private messaging on Instagram.
Okay, and also I'm gonna get all your stuff and I'm gonna put it on a video and I'm gonna upload the video. Then I'll give you the link to that too.
Fantastic. Thank you for having me.
I appreciate you coming on. It's been great, and talk to you later on.